Hi everyone, it's your boy Dr. Ike again. Come and speak to you about some things about Nigerian practice. Dun, 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 dun. So today I'm going to be talking about private practice in Nigeria, what it's all about, and just give you some tips about it. Okay. So basically, what is private practice all about? I'm just going to tell you my story, and you get a gist of the whole thing. During the course of my house job, I was able to do some work in a private practice. And after private practice, I went to, after the house job, I also got employed in a private hospital as well. And subsequently, I worked for the state government and now I work for the federal government. So I've worked in all three tiers of medical practice in Nigeria, and I can give some information which I think is going to be beneficial to anyone listening to this. Okay, so let's start with private practice. Private practice is also called private hospitals, still used interchangeably. During when I was there, are basically two types of private practices. That's my definition though. There's no like fundamental two types. My definition, and I believe that like the small business and the bigger ones. The small business, the types that have like two, three, four doctors and very few patients. I have the big ones that have the very big buildings with lots of patients, with lots of staff, and works like a company, you know. And it's able to work in those two types, so I could give an idea. So it started with a small business. When I was in Umuahia, Abia State, I worked in a small private practice, and then it was basically run by medical officers. That is the rank you get after you finish house job. During house, you'll be a house officer, and after house job, you become a medical officer. So I basically worked, um, did that after my house job. Also, when I was a medical officer, worked for a small private practice. We had very few doctors and very few patients. And the medical officers who did all the treatments, we rarely had to invite a consultant to send a patient. Probably because the hospital wasn't affiliated with any consultant. So those basic malaria, stroke, typhoid, ulcer, those like many cases, we handled it ourselves. All the complex cases we transferred that to a tertiary center for management. So that's what it's all about. And the management was quite lax. It wasn't like or rigid and thing, but we had very good communication between the staffs. We like equal, so we couldn't really but maybe I like equal, we were sort of as equal, so we were like, one big family or one big small family, put it that way. Then after that, I went to a different city, a different state, and I worked in a bigger private hospital. And this one we had about 10 doctors with a lot of nurses and management staff and had lots of consultants. So it was like residency again, sorry, like house job again in a bit, where we had to discuss management plans with our superior before we executed, because of the hospital was sort of arranged in a very formal manner, so their license to um, their license to to malpractice or cut, they could get sued if they mess up. That's just what I'm trying to say. So we had that structure, and it was quite interesting. Now, so let's talk about. So that's just a basic summary of what to expect from private practice. Can that be the very simple one or the quite huge, complex establishment? So let's talk about what to really expect from private practices. Okay. Now there are upsides and downsides to private practice. Like every other thing in life, nothing is perfect. Okay. Yeah, nothing is perfect. I'm quite good looking, but you know, I have a big head, so nothing is really perfect. Anyway, so what do you really expect from private practices in Nigeria? Um, One, you have time, and most private practices are in shifts, and it's something which you're going to be informed prior to starting. So there are some that run three shifts, three 8-hour shifts. Some run two shifts, two 12-hour shifts. So it's something which you'll be informed on, if you should have to get clarified on before starting the job. Okay. Number two, another thing you have to clarify again is to know um, the the ability to bring someone else to cover for your shift. You know, for example, if you want to travel or have a business to take care of, some hospitals say you can only bring in local staff like an in-house doctor to help you. Some can like to bring in somebody from outside to come and that's a doctor that's work for a doctor that's not affiliated with the hospital, so the person can come in there and work for you. So that's something which you have to clarify prior to getting a job. Another thing you have to think about is the salary. Now, that's the unfortunate part about private practice is that the salary scale is quite poor. Like where I worked is between 70 and 150 and rarely 200, and they rarely increase as well. So when you consider the years you spent in medical school or the money that was spent in medical school, and you think about how much you're going to earn, it's quite sad. It's quite sad. So so it's something. So when you get into private practice, I believe private practice has to be a transient phase in life. It shouldn't be permanent. It's something which you get out of house job. Is going there. When you're in private practice, you then decide on the direction you want to take in your life. If you're going into residency, if you're going offshore jobs, if you're going in for, if you want to remain there or if you want to go outside the country. So it's a period where you decide. If you've not decided yet, it's a period where you can decide on what you actually want to do with yourself. So I advise everyone who is in private practice now, who is just getting into private practice or who is still doing house job, the person should have a path mentally, have a goal, so that if they go into private practice, when they start private practice, they follow it head on. If not, they could get stuck there for years. Yeah, for years. Then another thing is that there is low chance of promotion. Some institutions have something called like a senior medical officer, or a principal medical officer, something like that, or medical superintendent, which is just glorified medical officer basically. So it just means you're going to do more work, and earn more, So it's something which one has to really really consider when deciding to go into medical private practice. With regards to and also they do weekend calls, so sometimes you could work over the weekend. So it's crazy, it's really really crazy, and for the remuneration is quite crazy. One of the best shifts in private practice is evening shift, right? It's evening. Wow. There are pros and cons of evening shift. Now the pros of evening shift is that that's the night shift in some centers, is that you may not get any patients, so you can just go there chill, and if it's a good place you could go with AC, you just go sleep and wake up the next day and go back home. Or you could have that crazy case that comes in and keeps you awake all through the night. So so it can be that. Then yeah, so that's pretty much it about private practice. I don't think I'm missing anything. I'm just talking off my head. I didn't script anything down. Well, that is it about private practice, and I hope you have enough information to let you have an idea of what you'll be meeting. For those who are outside Nigeria, who's going to come back here, you just have an idea of what you're likely going to expect. It's not the same for everybody, but for some people it turns out to be that way. And so I just want you to, be positive. Also, be positive. I was in private practice for about 5 months, and I got a government job. And after a few days, I got a federal job. So there's always room for improvement and for promotion. All right. Yeah. So that's pretty much it. Have a beautiful, lovely month of August. By next week, I'll be talking about what to expect in a state job from my experience there. So you guys will have a swell day. All right. Love y'all. Bye bye.